I think when we look at the landscape of behavioral health, we can identify some systemic problems to the way care is delivered, the way programs are structured, how they operate in silos, both intra-agency and even sometimes interagency, that they don't function well in their setting. And sometimes what we have in some settings is we have departments that have varying or different value propositions of what they're trying to do. A very common one is you have a treatment program and you have a call center. And the call center's main goal and value is to put people into beds, and if it's an out-of-network program, if they have excellent insurance, right, that's their criteria. And you have clinical programs whose goal is to provide good care, create good outcomes for people, treatment plan effectively, and keep them moving forward. And sometimes those things don't line up well. So siloed interdepartmental and siloed organizational care sometimes is one of our criticisms, or one of the major challenges in providing excellent behavioral health care. I always want to caveat that by saying that even in some of the most siloed agencies, in the most dysfunctional programs, what I never want to discount the fact is that there's some really caring, compassionate, dedicated people working very hard and doing their best to navigate some of these kind of fractured systems, external or internal, to kind of get there. What's different about Ava Health is that we come in with a core value of integrated care services. What Ava proposes to do, which is very different, is look at the full client experience holistically and address the issues in care that's really vital for them to kind of move through these sequences. Very firm believers in Maslow and their hierarchy of Maslow, and ensuring that we're shoring up those needs and moving up that need pyramid, so that we're not leaping ahead into self-esteem or self-love or self-actualization until we've dealt with some of the things around safety and security. So again, one of our common examples would be, I'm living sort of rootless and kind of homeless. Maybe I'm surfing around my friends' houses, and I have a dog. And so you start talking to me about coming into residential treatment. And one of the common things that would be said to those clients would be, you need to let go of your dog. Like, you need to put your recovery first, right? You need to let go of your girlfriend. You need to let go of your boyfriend. You need to put your recovery first. And again, to me, that's so counterproductive and counterintuitive, because how can you talk to somebody once they're in treatment about their self-esteem, their self-actualization, about getting sober and living a different life, when what they're worried about is the safety of their dog, the security of being in a relationship with somebody. We said to them, or they're worried that they're the sole breadwinner, right? But we said, like, if this is important, you need to let go of all that. They're the sole breadwinner, so they're now worrying that they and or their family is going to be evicted. And yet we don't deal with that. What we deal with is, let's talk about your trauma. Let's talk about your family of origin issues. So again, these are fundamental moving principles that Ava incorporates into everything we do, in addition to working in all those other higher levels of the Maslow hierarchy, which is being ready and willing whenever it's appropriate through someone's journey to treatment to talk about the trauma, to talk about the family of origin issues, and see how those things create negative impacts in their lives. So again, it's an organization that keeps the door and keeps its arms very wide open to put them around clients and work with them where they are.
Hello, Ava Health.